I could have chosen not to transition. And I firmly believe that would have been the wrong choice. I personally didn't notice that change as much until I'd been in it for a while.
Okay.
And I recognized it's like, oh, I can cry now. Even if I'm never entirely happy in my body, that's by no means exclusively a trans experience. There is this unhealthy narrative that you have to transition by a certain age or there's no point. It's not too late. It's not too late.
Hello everyone, this is Sex Positivity Unfiltered, where we talk about sex and we are not polite about it. My name is Lindsay Murray.
And I'm Denise Stratton.
And today we are discussing the realities of living as a trans individual in today's society. And here to talk with us today is Emory Quinn, who goes by Emmy. Emmy is a writer, performer, and educator from Dallas, Texas. She started her transition in 2022 at the age of 27. And in addition to talking about her experience, we will also be discussing what people should know about HRT and the realities of being a trans person in Texas and what that means for us today. So Emmy, thank you so much for being here.
Thank you for having me. Very excited.
Of course, we're excited too. This is a really important thing for us to be talking about. Not just us, but like I think anyone should be talking about,
100%.
especially given the political climate we're in. That's what we're going to talk about, like what that means to be living here in Texas. And I think the HRT aspect is really important as well. And we were both talking. We probably have things to learn about that.
Oh,
you
100%.
as well.
I mean,
So,
I'm
Right.
big in the queer community, but I have honestly no idea what HRT is. So if you don't mind kind of giving us like just a backstory of where you're from, like where you grew up.
Right. Okay. So I grew up here in the area, mostly in Fort Worth and Arlington. So I grew up in pretty moderately conservative households and environments. Nothing wild, but I guess I'd call it like personally conservative. The mentality was very much it's like yeah, be kind to people and everybody's their own person, but don't do anything weird.
Yeah, don't be a rebel now.
Yeah.
typical Texas household.
Yeah.
Yeah. Which, honestly, all things considered, kind of could be worse. I knew I was bi since I was maybe 10 or 12. And I guess the first inkling to me that there was something going on with my gender was feeling like that I liked women differently from, other quote unquote boys. I remember when I was like 10, I found out what a lesbian was, and I went like, it's like that. I want to do that. Can I do that?
Yes.
And the answer turned out to be, yeah.
Yeah.
That's good.
Yeah. I think this is relatively common for people who transitioned a little bit later. We have this one sort of standard narrative of transness, which is that like I've always known who I was inside, but a lot of people don't really know it or understand it until they're older, because it's only relatively recently that transness has been thoroughly in the public eye.
Yeah.
For a long time, it was very much considered a fringe thing that was not talked about hardly at all.
Yeah, pretty much part of the kink community is really
Yeah.
A lot of the queer community was part of the kink community.
Yeah, very much so. It was, very much so.
Yeah. Can we go to your discovery? Because I want to know what that looks like, especially when you said you didn't look at how girls were like the other boys. So when you say that, do you mean like, because I relate to that 100%, because I would look at like the Backstreet Boys, right? Backstreet Boys were my favorite band.
Yeah.
100%. I had posters of AJ on my wall, like 100%. But now that I look back on that, because I never felt a crush on AJ, now that I look back at how AJ dressed, I very much emulate that. So I would look
You're
at
almost like inspired by him in a way.
Inspired is the perfect word.
Okay.
Yes. So is it similar? Is that what you're saying?
Yeah, there's some overlap here.
Okay.
I feel like some of it is, and this has become clearer to me as time has gone on. Every once in a while, I'll think back to a moment in my teenage years and be like, it's like, oh, no, yeah, that was going on. Because a lot of the trans experience, especially like pre-transition, is what's called gender envy. Seeing somebody and, wanting to present the way that they do.
Gender envy. I
know, right?
like
It's
that.
a good, it's a good word.
It
It's a good
is.
word.
That's a good
And
phrase.
it's very much not exclusive to trans people. A lot of, I feel like it's I was about to say I feel like it's more common with women, but I guess it's also like very common with men, seeing people with different body types, people who are, more muscular or curvier, and feeling that you would be like affirmed in your own identity if you looked more like them.
Yeah. Yeah, 100%.
And then there are other ways that you can do that, just like you said, with fashion choices,
Wow.
forms of gender presentation, as opposed to having, genetic luck and looking certain ways. It's also kind of worth noting that this is a feeling I experience for women who look nothing like each other, like rail skinny, curvy, tall, short. It's a feeling I experience from a lot of people, despite very much loving how I look at this point. I still feel that a lot.
Okay. Yeah, no, that's fair.
But yes, I definitely think it is something that's kind of like that. Every once in a while, looking back, I'll think I was attracted to someone, and often I was also attracted to them, but recognize that it's like, no, I only wanted to be her, to be more like her.
Yes.
I'm glad we're talking about this, because I feel like there's this misconception that trans people just wake up one day and are like, I'm trans now. Like it just happens like that.
They just wake up and decide to choose a different gender.
Right.
Yeah.
Like it just happens like that. And that's very much not the case. Like I'm even thinking about like, clients I've worked with. I mean, the story starts, I mean, it is a transition. It's like over time, right? Like there, like usually it is when you're a lot younger, like you're a kid and you can tell something is maybe different or unique about you. You don't quite have like the language for it. And then it like evolves, right? And so the way you're explaining it, like it makes total sense to me.
Oh,
Like,
yeah.
It that does. Yeah.
There's a lot of discovery just in general, and just in the queer space, just overall. So I can even imagine, especially in.
Yeah. I think that discovery is a good word for it. Discovery is a good way to put it. A lot of people do have that moment of epiphany.
Yeah.
But to me, more often than not, the epiphany is I need to transition, or I can transition, or recognizing that this feeling that you've had consistently over and over for your whole life, or for an extended period of time, of like, I wish I was a boy, I wish I was a girl, is not a universal experience among teenagers.
Yeah.
And you are recognizing it's like, oh, I am trans. It's recognizing that all of these experiences that you've had with yourself and how you feel about your body and your name and the way that you're perceived, those feelings that you've had for a long time mean something.
You said it better than I could have said it, right? Like if there is that moment of, wait, like maybe this is who I am, it is coming from like this collection of experiences, right? Not something that's just sprung upon you.
Yeah.
And that's why I think representation is so important. Like a lot of people, especially when you see it in the media, they think representation is turning kids queer, turning kids trans. This is the cause and effect, right? However, to me, I would have absolutely loved to see someone who looked like me in the media when I was a little girl. Like I had to cling on to the AJ from the Backstreet Boys in order to find something that kind of what I wanted to be, right? But if I would have seen someone who was androgynous, a masculine woman who looked a little bit like me, it wouldn't have turned me queer, because I was always queer. It would have just given me the ability to recognize that, okay, it's okay to be this person.
Yeah.
Right? And so that's why I cringe when someone says that the media, like,
the agenda, they're trying to turn our kids gay.
And I'm like, no, you can't turn someone gay. What you can do is you can just show them that it's safe to be who you are.
And that argument is always so silly to me, because like a majority of, I think our media has gotten a lot better, like shows and movies and like people who are famous. Like we see more, I think, queer representation now than we did, 30 years ago, or like whenever we were kids. But like that argument is always so silly to me, because especially like at the time that we were all growing up, media was pretty straight. Like movies were pretty straight. Like you would
100%.
see straight
Oh,
love,
yeah.
straight relationship. And I'm like, no one's turning straight from like those movies, right? Like if you're queer, you would like still know that.
Yeah.
So the argument is always so silly. Like if you put that argument in reverse, I'm like, it doesn't really work that way though, that it's just going to turn someone to this like certain sexuality. It makes no sense.
Oh, if we apply
Mhm.
logic to any of these scenarios, they break
It
down.
never makes sense. Yeah, yeah.
But okay, so I want to go back to 10-year-old you, where you were discovering you were bisexual. One thing when we're talking about discovery, a lot of it is the fact that you didn't have the language or you didn't have the representation to really attribute that. Did you know what being trans was when you were 10? Or when you were
No.
Did you know what being bisexual was? Did you have any?
I did,
Okay.
but this is kind of worth noting that I decided, like, well, that's not me.
Okay.
Like, this is just a thing, and I'll, experiment or whatever with some people, and then I'll be normal. There was a lot of, and then I'll be normal. I actually talked to people about transitioning like 3 years before I did, or maybe it was 4 years. I can't remember. I was 23 or 24.
Okay.
And I got together with some friends and I experimented with makeup and using different pronouns and wearing more feminine clothes. And I just sort of let it fade into the background and decided, like, no, instead I'm going to be normal, which was a bad decision. That was not the right decision for me. I think the reason representation is important is that for a long time throughout history, there are people who are trans, like
100%.
intrinsically, who just pushed it down and never really knew or understood because there was no conception of like what being trans was, or that transitioning, whether that's socially or hormonally or surgically, there was no conception in their mind that that was an option or a possibility. And, for a long time throughout history, it wasn't. But, now we have more options as trans people. But going back to what I was talking about, at like 23 or 24, I decided it's like, no, I'll be normal. I'll be a little bit weird with my gender stuff. I grew a beard, which is famously called by trans women and trans femmes the denial beard. Like,
Okay.
it's a thing. It's a thing that some of us do. I think that probably even before that, I had kind of this idea at the back of my mind. It's like this is kind of a thing with me. This is a thing in my head. But if there's a time for it, I'll do it later. And then like end of 2021, beginning of 2022, I just woke up and I was like, shit, it's later.
Yeah.
And I just kind of recognized nothing was coming to help me.
Okay.
It was a decision that I had
Mm-hmm.
to make, and it wasn't a decision that anybody else could make for me. I could have chosen not to transition, and I firmly believe that would have been the wrong choice.
Yeah. Okay.
But I wasn't going to spend the rest of my life waiting for the decision to be made for me. So I just decided to try. I decided to see if the feelings I'd had most of my life about my gender feeling off meant something, and they did. Very much, very deeply.
Oh,
And I have not ever regretted the decision to start HRT.
Okay, so I want to unpack that a little bit, especially because I relate to this story so much, Emmy. You have no idea. So I'm assuming a lot of people in our audience too. So you were there putting on makeup. You said you put on a couple women's clothings and everything.
Yeah. Like friends, I talked to friends about it.
Okay. Was there something like that came over you whenever like you put on the clothes, or was there shame? Like, what was your mental space?
It just feels so long ago. I guess it was looking at myself and still meaningfully like not liking everything about the way that I looked and not like entirely feeling at home in my body. It's like I like being in this, and yet at the same time I don't like the way that I look in it.
Okay. Yeah.
But still recognizing it's like I like this.
Okay.
I like doing this, and I can be happy
Yeah.
in this.
Love it.
And that was kind of the last thing, is feeling like even if I'm never entirely happy in my body, that's by no means exclusively a trans experience. You know, body dysphoria or even just like body image issues or just not liking specific things about your body is not exclusive to trans people.
It's universal.
Yeah, it's universal. And there is kind of a layer within the trans experience of seeking to meaningfully change your body, change your physicality to be more in line with who you are.
100%.
There is also kind of this process of accepting your body as it is and for what it becomes. And I think that that is kind of a universal experience.
That's hard to do for everybody.
Hard to do for everybody.
Yeah. No.
And come a long way on that.
Yeah,
Like for real.
We've talked about disliking our bodies here on the podcast extensively.
Yeah, I mean, you're right. That could really be true for anyone. You know,
On a
like,
sex positivity podcast? What?
Oh,
No,
yeah,
what
I
the-
know. I know.
Yeah.
It's one of those things that is just so hard to do. You know, you hear it all in the media, like you should love the way you are, and you know, on this podcast we do preach different bodies are great and everything, but it's just you're your own worst critic, right? So you look in the mirror and you always pick out little things that you just dislike.
I could probably see someone with like a similar body type to me and think they look great, and then I can look in the mirror and I'm like, I'm not crazy about this. Isn't that the weirdest thing, right? It's just it's hard to explain. But essentially, what you're getting at is that there has to be this freedom to explore when there's like no guarantee of like how you'll feel about it, right? Like your decision to transition was right for you. Like this big argument that I'll hear, like let's say someone decides to transition and then people will ask like, well, what if they change their mind later? And I almost think there needs to be a freedom to change your mind later. What if you do, then you would deal with that, like if that were to come, because the alternative is you just never even take the step. But what if that step is right for you?
No, to a lot of people, gender expression is fluid. Like,
right.
Is 100%
Yeah, fluidity
fluid.
is the word.
Yeah. Well, I mean, this is a thing that gets talked about in a specific way, and I'm actually glad that I kind of have the opportunity to talk about it, is that one, everyone should have the opportunity to play with their gender identity and expression with zero risk.
I love that.
Like, this is something that people have talked to me about. It's like, well, I know a teenager who was assigned female at birth who started using he, him pronouns and did all this stuff and then just changed her mind and she's just a girl. I'm like, okay, cool, good. You should get to do that.
Yeah, that's what I think too. It's like, because something could feel right for you right now. Like, hey, you know, I want to go by he, him pronouns. That feels right to me, like where I'm at right now. But then you could change your mind because we grow and evolve, right? Like, I think that should be allowed and doesn't have to be that big of a deal.
The space to be able to explore without taking risks, I love that phrase because from what I can tell, you had that with your friends. You did this with your friends, right? The first time? Okay. So they gave you that space, right? The same for me. The reason I even asked that question is I wanted to bring up a very relatable experience to where I dressed girly for the longest time, feminine, just because that's what I always knew. I tried to venture into like wearing hats or more t-shirts or cargo pants or things that were kind of in the middle, but like maybe more jockey femme, right? So I tried that to kind of get a little sense, but it wasn't until I had my girlfriend at the time, she's my ex now, she had a bestie who absolutely, and I never seen this before ever because I wasn't in the queer community at the time, I had a lot of straight friends, but she had a bestie who's femme who absolutely loved masculine women. And I had never seen that before. Ever. And I mean, I was just like, I want to be your bestie's girlfriend. Like I saw that and I was like, this is amazing. And that being her bestie, she recognized that in me a little bit. So she pulled out a band t-shirt and some cargo shorts, some board shorts way back when we're talking the night, like, you know, old 2000. But yeah, the board shorts. And she was like, you know, you should put these on. And she dressed me. Put my hair in a hat. I remember this moment so vividly. I looked in the mirror. I saw my presentation. I saw it was more masculine. I think she even put me in my first bracelets too. And everything felt at home. Like that was me. And I haven't turned back since. I am now 100% more confident in what I wear, and I absolutely love the way I dress. I love putting that tie on like that. There was that little bit of discovery, and I just needed that safe space. Because like I said, I tried this before, but it was always with straight friends, right? So they always
Like, Denise, okay, it looks okay. Yeah, you're fine, but you look a little too boyish.
or whatever. So I never got that space until that ex, until I was with her and her group of queer friends, and she put the outfit on me, and I was just like, everything clicked. And that was my experience. So the fact that, again, giving people the space to where they can explore without risk, to me, is so important.
Yeah, I think that's wonderful. And I mean, it kind of speaks to this idea that I think is kind of is really important, that there is kind of identity in gender expression. It's not necessarily the same thing as, a gender identity, but at the same time, it is an identity. It is like part of you, and it is meaningfully, deeply who you are. That there are people who are not trans who have these like very strong gender expression identities, like butches and femmes and femboys and all of these other expression identities. It's really just that this is not exclusive to trans people.
Not at all.
These feelings of gender euphoria and this diversity of gender expression that is really important to just the happiness and the completeness of the experience of individuals.
So how's your mental health now when you look in the mirror? Like when you look in the mirror and you're in your dress and you're feeling all, is it much different than 23, 22, 23?
It definitely is.
Okay.
I am so much happier.
Yeah.
I think that this is a big thing. There's a transgender comic artist called House of Decline. That's spelled funny. That's not really important right now, but she has a comic that just shows a dude and it says, "Man, I have so many mental health problems. But what if?" And then it shows a woman and she says, like, "That solved about 70% of my problems." Kind of pissed about the 30% that it didn't. I think that a lot of trans people expect transitioning to solve all their problems. And it really does solve kind of what is usually your one biggest problem.
Okay, yeah.
But then after that, it really just gives you the opportunity to figure out how to solve a bunch of your other problems. It's like, okay, so we got that one out of the way. And it's like, okay, actually, I am also kind of depressed and things like that for other reasons.
There's I'm going to wear my therapy hat for a second here,
Cool.
but there was a study. Whenever there's research studies, you can always interpret the data in a biased way. I will say that,
Statistics,
right? And so there was there was this research going around that I'm for anyone who's like just listening and not watching the video, I'm using like quote unquote, right? Like there was a study going around, and the incorrect interpretation of it was like, oh, people who transition report having like worse mental health outcomes like after they transition, or after they start their transition. Like, sure, you can interpret it that way, but it's actually not true. The truth is mental health outcomes get better for a majority of trans people once they start their transition. But just like you were saying, there can be that 30% where it's like, I still have like depression, anxiety, or maybe someone has OCD that's always been there, right? That they can like now work on. But the piece I wanted to add was just, we have to recognize that like, if you start transitioning and your mental health gets better because you feel more in line with like who you are, we also can't forget that we live in a society where trans people are getting killed. They are being discriminated
I was about
against.
to say exactly that. Yeah.
There are bills coming. I mean, there's this like trans erasure happening, right, in our world. And so like if you get this experience where I'm starting to feel more at home in my body, I like how I'm expressing myself, I have a good support system, there's this other piece where it's like, but also I live in this world that openly hates who I am. Yeah. So how can I just be rid of like any mental illness when you're facing like constant discrimination every single day? So, that's something I see too, like even at work, it's just even going to see a therapist is going to be hard to lower depression and anxiety as an example when as soon as you leave my office, you're back in this world that isn't open to you.
100%.
You get what I mean? Like I always like
Yeah.
add that piece because I'm just like, guys, like if we're looking at this research, this data, and there's poor, mental health outcomes, who's really responsible for that? Like it's us, like not like us specifically, but like us, the people of the world who have created this environment. You know what I mean?
Yeah. Here is the thing, and I'm glad you said that. It lets me kind of go back to something that I wanted to talk about.
Mm-hmm.
Detransitioning is uncommon,
Mm-hmm.
but it is a thing that happens.
Yeah.
The most common reasons that are cited are either that these people conclude that they have kind of a more fluid non-binary identity and they choose to present a different way. So someone will come out as a trans man or a trans woman and sort of come to the conclusion that they don't need to be on HRT after all, that they have a more fluid identity. They have something like in the middle or sort of kind of completely outside of the traditional spectrum of gender that goes from masculine to feminine.
Yeah.
But I think that's totally valid. And I don't think coming to that conclusion undermines any of those things. Those are steps in a process of self-discovery.
Yeah.
Discovery. Yeah.
Yeah. But the most common reason, I believe, for detransitioning is from societal prejudice and fear for safety and just the constant experience of transphobia.
It's survival. I
Yeah.
mean, it's survival. Yeah. And we don't, and just like like when I'm thinking back, like, interpreting data, someone who isn't looking at the nuance of it all is like,
See, there's these people who have detransitioned because, they changed their mind.
and I'm like, that's really not it. It's not like really that simple, right?
No.
Like if you live in a town or a family, or you don't have anyone that supports you and you're constantly facing scrutiny, I can't even imagine how tough that decision would be. Like I either be myself or I just survive.
No, that's
where
the
I'm
decision.
living.
Do I want to be myself and risk my safety, risk losing people I love, risk disappointing the people I love, or do I want to just shove all of this down and be normal, right? There's that word that I fucking hate.
Bad word.
Yeah, and that's literally the decision a lot of queer people have to make, and it drives me insane that we don't allow, like, this is just another level of discovery. Just like you said, everybody experiences discovery whenever they're getting older. There are things about you that you know now that you would have never known about yourself 10 years ago.
Right.
I mean, that's just how it goes. You can be 50 years old and then just realize, hey, I like to crochet. It's just that other added layer of discovering the things that make you happy. And if along that journey you have transitioned and then realized that, okay, maybe this doesn't align 100%, maybe I want to be non-binary, that's a discovery. Like, we should allow all humans to have that level of discovery. It's okay when it's a hobby. It's okay if you want to have kids, if it aligns to a societal norm. But if it doesn't align to the societal norm, that's where it's a problem.
Yeah. And there are people who detransition, who like regret transitioning, who sort of come to this conclusion, this was not right for me. The vast majority of those people still do not claim that being trans isn't real or that they were brainwashed. They just felt they were wrong about themselves. An incredibly small percentage of detransitioners say that and become right-wing grifters, trying to take away other people's choices because they regret their own and are paid large sums of money by the worst people in the world.
Well, that's who gets the most coverage.
Views.
That I feel like it's like that tiny little percent that says something like I was brainwashed, and then it's like, boom, that's what we run with. I'm mentioning this because there's so much like anti-trans bills being presented and stuff like that, especially here in Texas. If you look at like the population of the US, I think trans population is like 1%, or it might even be like less than 1%, right? But I saw this like, I mean, it's kind of funny, but it's also like really sad. But those clips where, like, people go and like interview like, what percent of the US do you think is trans? People will literally be like 25%, 40%. Like, people will give these huge percentages, and I'm like, that makes no sense. Like, that makes no sense. But it just shows you all it takes is like one message to blow up, and then everyone is convinced that, a quarter of the US is transitioning
Okay.
right now, and it's this bigger thing than it really is.
I mean, well, one, I wish.
Right. I mean, the percentage is probably more if people were allowed to be themselves, right? I would imagine the percentage would be more. But what we know right now, it's like 1%.
Yeah.
Yeah.
Well, we wouldn't know how many people were actually trans if it wasn't like this heinously
Right.
witch hunted nonsense thing. We would only know how many people were trans if trans people felt safe and comfortable
Exactly.
coming
Exactly.
out.
Yeah.
So, we only have like weird estimates to work with. But one thing that I want to make sure that I say is that, one, people who detransition are like human beings worthy of respect who have made their own decisions about their life, and they deserve better than to be treated as political props the same way that trans people do, the same way that everybody does.
Absolutely.
There is also something important that I think needs to be stated. The people who regret transitioning, the percentage of people who regret transitioning is incredibly low, and no other like medical process or procedure is held to this like bizarre standard of like, what if you regret it? You are more likely to regret hip replacement, tattoo. It's been consistently shown that people are more likely to regret having children than going through medical transition procedures.
Yeah.
And I'm not seeing a lot of people saying for that reason that people shouldn't have kids, or that people shouldn't get tattoos, or people shouldn't get hip replacements. It really is just this deeply ingrained transphobia.
I love that comparison. I absolutely love that. That was great.
Thank you.
Actually, one thing I'm realizing now is, I apologize, this actually might be a little bit longer of an episode than it normally is, just because we're still on question 1. And we're at 43 minutes. But I do think it's really, really important for us to actually tell the audience, let's go with some statistics. So sex and gender, 2 different things. Your biological sex has to do with your chromosomes, your body makeup when you were born. That is sex. That is, your biological makeup, correct? Gender is what's going on inside of your brain. That is something you get to choose. So they are not synonymous. Gender or even sex. Let's go with sex. Let's go with science right now. Sex is not binary. Like, a lot of people have this stupid misconception that sex is a binary male or female thing. They cite nature, that this is how nature goes. That is untrue. There is male, there is female, but then there's also a third sex. It's called intersex. It's like these people are completely erased. And one thing that a lot of people don't realize is that the intersex community makes up almost 2% of the population.
Yeah.
Which is an insane number. So just to put that into like comparison, the amount of redheads in our population is 2%. The amount of twins that you know is 2%. So I want you to think of all of the redheads you know. I want you to think of all the people that you know that are twins. That's the exact same amount of people that you know that are intersex. And yet we say that they don't exist. Or we say that they're a mutation, which... so is twins, so is redhead, so is blonde hair, so is blue eyes. Like, to me, like, there should be no if you're okay with giving a redhead the same rights as someone who's blonde, you should be okay with giving the intersex community the same rights as someone who is male or female.
Right.
Like, to me, the science of sex is ambiguous. Like, it's not binary. It's not black or white. 2% is that's millions of people. And yet we just completely erase that they exist. So I apologize. I had to go on that soapbox real quick.
I mean, I also kind of want to say something like it's also kind of a miscategorization to describe intersex people as a third sex, because it's actually like a broad category. There are there's a large number of different ways that you can be intersex. You can have intersex chromosomal presentation, like you can have XX chromosomes and present like conventionally male, or vice versa, XY, and present as phenotypically female. You can also be hormonally intersex, so that your hormonal makeup is completely out of line with your sex trait anatomy. You can be genitally intersex, like your genitals developed differently from what's conventionally male or female, precisely. or you could be any number of combinations of these things. So I don't even know how many sexes hypothetically there are under the intersex umbrella, but it's a lot. And within being what we would call like assigned male or female, there is wild diversity with all sorts of just like those primary and secondary sex characteristics. How curvy you are, how large your breasts are, how muscular you are, your hormone levels, without ever like getting into being intersex. There's just this wild diversity of what it means to be male or female, what it means to be, like masculine or feminine. And then that is all without presenting, the social construction of gender.
No, I love that.
It's a lot.
Yeah, but it's good to know about that though. Because I think what I really think it is transphobia through and through. But people want to be in their comfortable little bubble. It's easier if things are black and white. It's easier if there's only two sexes, only two genders. It's just easier. It's really what it is, right? And people just don't want to get curious. No. It's easier to get judgmental and hateful and keep things how you want them. But I wish people would realize, like, the world isn't really just about you.
No.
You know what I mean? If you want things a certain way because that's what you're used to, I think that's really unfair and really selfish. And 100%. You could just learn. You could just get curious. But people don't want to do that. It's really sad to see the lack of like genuine curiosity and the lack of interest in learning new things.
Yeah. I mean, that's what science is. It's just our observation of the world around us. And it's always changing. So yeah, I mean, going back to like getting, I guess, more what would be open to the idea of fluidity, and then you decide to actually make the jump. I mean, tell me your experience with HRT or how that process went.
Yeah. So when I say I started transitioning 3 years ago, it was almost exactly 3 years ago. It's like 3 years and about a month.
Congrats.
Now. Thank you. In my mind, what that is to me is that's when I started HRT.
Okay.
So HRT, it stands for hormone replacement therapy, and it is the process by which you take sex hormones to physically transition, to make changes to your physical appearance and to your brain chemistry, because hormones affect everything about your body. You think pretty considerably differently with your primary hormone being estrogen versus being testosterone.
Interesting.
It's you experience your emotions very differently.
Okay, yeah.
It's it's wild. And I think that you don't notice that change as much or I personally didn't notice that change as much until I'd been in it for a while.
Okay.
And I recognized it's like, oh, I can cry now.
Okay.
That was kind of the thing that was biggest for me, is that I wanted those physical changes that HRT could provide, and choosing to start that process and, being happy with it and staying with it for 3 years now. That has been sort of the defining element of transition for me. I think mostly I'm going to talk about that for this, but I do kind of want to emphasize that is not universal. There are trans people who do not go on hormones at all, who can't for medical reasons, or who are not interested in it and they just want to present differently. They only want to socially transition, or sometimes they only want to go through surgical procedures to transition. Trans men get what's called top surgery to have their breast tissue removed. And sometimes some of them only do that. Others take testosterone to masculinize their bodies. Okay. And there are transgender women who don't take estrogen, and they're completely valid, but there are other actions people take to transition physically.
So we're gonna break this down all the way from the beginning. So you said you were 27, correct?
Yeah, 27.
Okay, so you're 27
after 3 or 4 years of push it down. Let's just be normal and make middle management at some corporation, and it'll be fine. Then one day, I'll die.
Okay, so what did Emmy look like at that time when you're deciding to actually go pursue HRT? Were you in dresses? Were you dressing feminine at this point, or were you still presenting
like
masculine?
I immediately started pursuing
Okay.
like HRT. It was important to me to go through a provider that went with an informed consent model.
Okay. Okay, so you get on Google
Yeah.
and you just Google the HRT providers?
Yeah, well, I mean, the
okay.
thing is that I knew a lot about HRT providers, which should have been a sign. I thought everybody was learning what I was, and kind of when I got there, I was like, oh no, I was constantly searching out information about being trans because
Okay.
it spoke deeply to me.
Mhm.
Okay, so we're not going to tell anybody that it took me this long to figure this out.
So how's that process? So you find a provider. Do you have to go through any like beforehand things before they just give you the drug?
It depends. For a long time, you had to jump through wild hoops to do
Okay.
it. You had to present as your desired gender for, I think it went by state, but like it was 1 year, and in some states it was 3 years.
How would they know that?
Huh?
How would they know that you're presenting? Like, do you have
I
to
don't know,
show
you get
footage?
letters, you talk to mental health professional would confirm. You
we
needed
come
letters
in.
from a mental health professional.
We still have to write those for people who want surgery. They have to get a letter from us that states like how long they've presented as like this certain gender and all that kind of
So
stuff.
you have to present for a year before you get to decide to do.
I don't know what it is now, but yeah, it's been that before.
Now my understanding is that surgeons want confirmation from a competent mental health professional that yes, this is a person who has been transitioning, who is this is not someone who is unwell, who is seeking out something, and we shouldn't be doing it for them. I understand that for sex reassignment surgery. I'm not going to talk a lot about that just because like that's not something that I intend to pursue, and I don't know. I don't know enough about like the guardrails to speak intelligently on it.
Just so you know, like from a mental health aspect, like when I'm writing those letters for someone to get surgery, there's a lot of us, which I think is especially important in a place like Texas. I mean, there's a lot of us providers that we only require one appointment with a trans person to write their letter. Now, and I'm mentioning that because like if someone comes to me and is wanting surgery and they're telling me like, hey, I've been trans for like this many years, I've done HRT for this many years, as a whole, I believe them, right? Like I'm not gonna ask for like, okay, show me photos from 5 years ago to make like I'm not gonna like even as a mental health provider, like I'm just gonna believe you, right? And I've never run into anyone that I feel is like lying about that, or it's not been my experience that people are just making stuff up to get hormones, right? Like so like even as I'm just sharing with you like anything you feel about that like would never be offensive, because I do think it's a little like if I ever met a mental health professional who was like going through these like extraneous checks or something, I would think that's a little silly.
I mean,
you know what I mean?
When someone tells you who they are, believe them.
Exactly. I just believe them. So I just had to throw that out there.
Yeah. For a long time, there was kind of this school of thought that being trans was a mental illness.
Yeah, absolutely.
Because you couldn't get rid of it. Gee, I wonder why you couldn't just get rid of it.
Yeah.
The best way to alleviate gender dysphoria was to allow people to transition, but it was so given out as this by medical professionals as this consolation prize. It's like oh well, I suppose this is preferable to you being in such horrible agony, you pitiable creature, whereas that's garbage. I love being trans. I love who I am.
Yeah. And and last thing I'll throw out there, especially for our listeners, like if I see a trans person that does have, let's say, a really severe mental illness, let's say they're suicidal, something like that, I never equate that with being trans. Like I've never once been like, oh, maybe because you're trans, it's like
it's
it's
because
causing
you're trans.
this thing. Like I never have done that. Like if someone came to me and was wanting HRT or surgery or whatever, but they were also presenting, I'm using a very extreme example, but they were also presenting like, hey, I'm suicidal. That's still, I would want to treat that for, like, I want you to live, right? So I'm like, let's, like, clearly you need some help with your mental health. Like, let's do that.
Mm-hmm.
I still don't think that's like a disqualifier for like getting, like, however you want to transition. Like, I still think you should be able to do that. But if there's like an extreme mental illness, like, we'll still work with that. I'm just throwing it out there that, like,
they're separate things.
Yeah. If there's ever this, I really hate that there's this like, oh, if you have a mental illness, it could be like a disqualifier.
Yeah.
Right, for getting what you want. I don't really like that.
Yeah.
I just think if there's something going on, we treat that and still get you whatever you might want or what you're asking for, right? So anyways, throwing that out there.
That is kind of why it was so important to me to find an informed consent HRT provider. Planned Parenthood is one. There are private services like Folks and Plume. That's FOLX. And essentially you make your appointment and you go to them, and if you say it's like, hey, I'm trans, I want HRT, they say it's like, okay, you're an adult, I believe you.
Right.
Here are all of the things that HRT is gonna do, and here are the reasonable but existent medical risks. There are small but real medical risks to HRT. Some people, like, very rarely people just can't go on it for medical reasons. I just cite that. I don't necessarily know what those reasons are. They're rare, but they exist, and I don't want to just like hand wave them away. There's a small risk of like blood clots on estrogen HRT. A lot of this hasn't been well researched enough because, well, transphobia and well, no, mostly just transphobia. But, you know, if they inform you of all that and then they tell you everything that HRT is likely to do and that HRT could possibly do, like it could decrease your sex drive. It is very likely to lead to breast development and fat redistribution to increase your curves. I'm talking about estrogen right now. Testosterone, totally different process. Essentially the opposite process. You get more muscular and your body burns more fat and you start growing more hair on your body. And this is kind of wild. This is a fun little transition fun fact. Testosterone thickens your vocal cords. So because I went through natal puberty, I have a deeper voice. My vocal cords thickened. Estrogen doesn't undo that. If I want my voice to be higher, then I have to voice train. Which is another thing, which a lot of people find very gender affirming. I'm kind of on the fence about it because it's a lot of work and I'm very lazy. It's the same reason I don't do makeup. But so
it's a lot,
but trans men, if they take testosterone, even if they've gone through like natal puberty, you know, the puberty that happens naturally from the sex they were assigned at birth, their voice will drop. From this second puberty that they're having, which I think is kind of bogus. That I don't go the other way, but theirs gets to drop, but mine doesn't go up. It's fine. I have like kind of a silly little voice anyway. You know, just that's a transition fun fact for you. But being presented all of these things that HRT is likely to do, including like in the case of estrogen, sort of the stuff that maybe you don't necessarily want as much, that it reduces your muscle mass, and it makes it, by the way, a lot harder to lose weight and a lot easier to gain it because testosterone burns a lot of calories.
Lucky motherfuckers.
I know.
This is a joke that I've made before. Hormones are sexist, all right?
I like it. Some bullshit.
But I mean, just sort of the understanding that if you hear all of that and you're like, it's like, yeah, sounds good, and you know, you're an adult, then yeah, they should just you should be able to get
Yes.
hormones.
Yes.
Oh, so that's okay. So yeah,
That's the informed consent model.
ignorant lesbian question. So that's informed consent, pretty much saying that, you know, as long as you know these factors,
Yeah.
you tell me what you want and
Yeah.
we're good. Okay. What would the opposite be? Like,
Huh?
is there
It
is there
would be,
another
It would be
option?
those things that we talked about, like the having to jump through these hoops, is that you have to get these notes from a mental health professional. You have to prove that you've been transitioning for a certain amount of time. There are these barriers to entry, and that is kind of the school of thought called transmedicalism. It is this
Mm.
idea that there are these requirements to be legitimately trans, that essentially being trans is, if not necessarily a mental illness, like a medical condition. It is a way of being that has to be proven to be legitimized through medicine.
Okay. Light bulb now. So are you saying that there are other states where it is literally just informed consent?
Yeah, it's a patchwork thing.
Okay.
It's a patchwork thing, is
Okay.
that I go through an out-of-state provider, so I just need to provide informed consent. You can do that in Texas. Not gonna-
for now.
for now. Okay.
Yeah.
But it is in other states, you can't procure things from an out-of-state provider. Also, I believe Planned Parenthood is an informed consent provider. I think that is a blanket thing.
Yeah.
Okay.
I don't know. If you are considering transitioning, do your research.
The informed consent model is the best model. Like
Okay.
I'm pretty sure there's even like statistics.
I mean, that seems
show
like it
that.
goes-
Yeah.
Because you give the person the information. It's their choice what they want to do with that information, and you go by their choice.
I feel
is
like
the best.
that's the normal in any surgery. Like it doesn't matter if it's medical or cosmetic. I mean, literally any surgery you go through, the doctor's going to tell you, hey, these are what might happen when you're doing this. This is what's likely will happen when you do this. Here's your consent form.
Yeah.
Let's make sure you read through it, please.
We do it with almost
Mm.
everything else, but when it comes to trans individuals,
Interesting.
historically having to jump through hoops. I mean, why is it different?
Also, a couple of things just to talk about is that I've taken several different forms of estrogen. Now I take injections. There are also patches or pills. They all have different pros and cons. There's also gel. I don't know a lot of people on that who take gel. It's also like country by country
Okay.
and doctor by doctor. It's very confusing. Transgender people kind of have to depend on each other's experience because the research on like the results of HRT are kind of spotty, but kind of the understood thing is that injections will help you see the most changes.
Okay.
Because it gets your estrogen level higher and it suppresses your testosterone more. Which is an interesting thing. I haven't talked about testosterone suppression. Wow, there's so many things to talk about.
So many.
Yeah. So in addition to estrogen, a lot of transgender women who choose to hormonally transition are prescribed what's called a testosterone blocker. Testosterone has a more pronounced impact on body development than estrogen does.
Interesting.
Yeah, so if you have a lot of testosterone, then that will have more of an impact on how your body develops.
Okay.
Even if you do have like a higher than normal like cis male estrogen level, which is why transgender women usually want to increase their estrogen levels, but also lower their testosterone levels as much as they can.
Because testosterone is the more dominant hormone.
Yeah,
Okay.
exactly.
Okay.
I have to mention here real quick that, and this is for, I think, mostly our listeners to know, but I'm also mentioning that, with the conversation around HRT, we're talking about transitioning, just to point out that people who are not transitioning or who are not trans at all also can go through hormone replacement therapy. And I'm mentioning it as a sex therapist. I've seen many women that will like, let's say that their libido is low and they'll take these like pellets that increase their libido. It's just testosterone. Right. And then if men have a low libido, they'll run out and get their testosterone levels checked. So,
yeah.
I've had cis women take testosterone for their libido before.
Yeah.
Yeah.
Right. So the most common testosterone blocker is called spironolactone, which is a really common medication for all sorts of stuff. I don't know all of it. It's been explained to me several times, and I forget because I've never taken it because injections lower my testosterone enough that I do what's called monotherapy. I just take the estrogen.
Okay.
But spironolactone, which is sometimes called Spiro, it will lower your testosterone level. But usually what it's prescribed for is, I think, sometimes as a blood pressure medication, but most commonly to clear up your skin.
Mhm.
Interesting.
Yeah,
So
so
like
people,
cis people, there are more cis people on Spiro than trans women.
and I really need everyone to know that because there is this, like, again, it's another misconception. It's like HRT is exclusive to trans people and we should be really worried about it. And I'm like, it's been around for forever, and tons of cis people.
Yeah.
It can go either way, you know?
The most common, I think it's still probably far more common for HRT to be prescribed to postmenopausal women.
Yes.
I think we've talked about that with Brandy. I'm pretty sure.
Yeah.
Yeah. That's crazy to me. So it seems like every facet of the trans experience is not exclusive to trans. Like the body dysphoria, the discovery,
No, yeah. Like,
guys.
you should all be doing this. We're doing it.
Okay.
Why are we the only ones doing this? Why are trans people the only ones like trying to do that? You should, like, why do you not want to discover stuff about yourself? We could all be having a way cooler time.
Yeah, I just feel like cisgender straight people just have to gatekeep everything. So essentially what we're kind of, I know it's a very broad blanket statement, but that's kind of what it comes down to sometimes.
That's
like,
so crazy to me.
That is another thing, is that like whenever I was like trying to get information on HRT, I'd like Google like HRT, and I would get like stuff like, it's like, are you going through the change? And I'm like, I'm trying to.
Love it.
Yeah.
If you would let me. Not the way you mean, but
that's good. Okay. All right. So HRT, what was the form you started at first?
I took pills.
Okay, pills.
Which is kind of the most common one, because it doesn't, for a lot of people, it doesn't get their E levels as high as they want it to be, and that one kind of has to be taken in conjunction with a testosterone blocker.
Okay.
As time goes on, your testosterone will stay lowered, and you can go off of a blocker, and estrogen will keep it at that level by itself.
Interesting.
Usually.
Okay.
I would also like to say, like, usually, if at any point I didn't say usually or generally, then that should be there, because it's a wildly personal experience.
Yeah, bodies are different.
Bodies are so different.
Mm-hmm. So I want to know what changes. So you start taking the pills. What changes were you noticing, like, at first? Like, and I want to know both physically and emotionally.
Well, like, you notice, I noticed emotional changes first.
Okay.
It's like, I felt, for one thing, it was just kind of a big thing to be on HRT.
Okay.
It's like, wow, I am doing better. I found it, like the thing I already talked about, I found it easier to cry. I just felt more at peace with myself. And part of that was estrogen. And part of that was like, I've undertaken this huge thing of self-acceptance, and I was doing other stuff. I was also like wearing dresses for the first time and like experimenting with presentation, and then trying makeup and recognizing makeup's a lot of work. Yes. And like, I like how I look well enough. It's fine. Maybe I should get my eyebrows done. That's just me remembering that I want to see how that looks. But sort of the first thing that I noticed was breast development.
Okay.
The thing that I told myself was that it's like, if I don't like what this is doing to my body, I can stop. And you can. And and kind of the consensus is, for the first 3 months, there's no changes that generally can't be walked back. Your skin gets softer and your body hair growth will get a little thinner. That's kind of all you're going to notice in those first 3 months, and maybe a tiny bit of breast development. Breast development is kind of the thing that can't be undone without like surgical intervention. So, but the thing that I thought was, if I am just wrong and I don't like what this is doing to my body, I can just stop. And pretty quickly I was like, it's like, well, we're not doing that. We're not stopping. I think that's something a lot of people have to tell themselves to make the decision to just to start. And then generally it's no, don't want to stop that.
Was seeing your breast for the first time, was that like you seeing like, oh no, this is what I like, this is what I want?
It's affirming.
Affirming. There we go. Okay.
Yeah.
Okay.
Gender affirming is,
I like it.
kind of the thing. Just like just take a word and you slap gender on the front of it. And that's what we do here in the trans community.
Okay. Okay.
Yeah, the thing that like I like my breasts, big fan, which was kind of the thing that I was like anticipating,
Okay.
that I was expecting, that I was hoping to develop. But like now as time has gone on, I've found that other things I'm way happier with and about other things that I've gotten from HRT is that, and it is like fat redistribution. I never really appreciated the distinction of like how like I'm gonna like
Curves.
use I'm gonna use curves.
Yeah.
I was gonna like try to like go for a big swing weird term with estrogenized bodies.
Oh,
But
okay.
yeah, what's up? Yeah, like look out for my gender studies class or whatever, I guess. But people who've like have estrogenized bodies have curves. I suppose I always noticed that and like that. I didn't quite appreciate how distinct it was from my body or how much has come of that.
Okay. So
like,
where do you see the fat distribution the most? Like in your hips and your
hips, thighs, glutes, just more there.
So
more
now
of
you get that walk, that hippie
Yep.
walk. Yes,
Yep.
girl. That's the best part.
Yeah, feels good. Yeah.
Okay.
Like for like very much so. It's kind of that has been something that has been really affirming that, was not what I was expecting as much.
Okay.
And my body hair has gotten thinner. I've also done like laser hair removal on my like,
oh really?
oh well, on my I've just shaved my legs. So
okay.
I don't usually because it's the winter.
Fair.
I guess it's not. Now it's not. Now I have to
We're in
crap.
Texas. No, no more.
I have to shave my legs again. Like I don't wear a ton of dresses. I've made the joke before that my gender is seasonal. I'll wear like it's getting warm enough to wear dresses again, and I love that. But that's another thing is that early on in my transition, this is super common. I was all in on dresses and skirts and everything.
Heels.
I was trying to be. I've never been in on heels.
Okay.
It's just a lot.
That's fair. That's fair.
My feet hurt.
That's fair.
Even
for a straight woman.
I understand.
It's a
I get
lot.
it.
It's a lot. Sensible shoes. I don't know if you don't feel attractive in heels, if it's not for you, don't do it. That's become my policy on everything. If like looking good should be for you,
Damn right.
doing this, that, and the other should be for you. I have never had any trouble getting interest from partners, that the kind of partners that I wanted to have. If anything, I turn it away interest at this point. So,
You're
don't
working
think,
it, girl.
do it.
You don't need
Do
the
it for you.
heels. You don't
Do
need
it
the
for
heels.
you.
Okay.
If I liked wearing heels, I would. I don't, so I don't. But in that first year, there is this need to prove something. There is kind of this need to constantly be perceived as performing femininity. And it's not like I don't wear these clothes anymore. I wore this today because, I did kind of more want to signal femininity a little bit, but also like this is one of the first dresses I bought. It remains my favorite. It's a fun casual dress. I also love that a dress is something. It is a one piece of clothing. You put it on and you're done.
For the person taking off the clothing, we also appreciate the one piece of clothing, just so you're aware. It's just really nice.
It makes going to the bathroom really easy.
Yeah, there are myriad benefits. Now generally I wear jeans and t-shirts.
Fair.
And it's just something that like you get more secure at a certain point in your femininity. And if someone can't tell that you're a hot girl, that's their problem.
Damn right.
So like, but I mean, it's like I bought different jeans. I bought like high-waisted jeans that my butt looks amazing in, but it's still jeans and t-shirts. Like my signature outfit right now is like some kind of hat, this crop jean jacket that I got that I really love, and a high-waisted jeans and a graphic tee.
Okay, hey,
Like,
yeah.
that's
a look.
that's
Trust
it.
me.
Yeah.
Yeah.
And like it's working great for me.
Yeah. Are there any things that HRT has brought that you didn't enjoy?
So for the first year on HRT, I kept my testosterone a little higher just because, like, I felt very much like, and I also often didn't use the term woman to describe myself. I would say trans feminine, which again is a very legitimate identity, and I still consider myself trans feminine. It's just that there was a point where I looked in the mirror and I'm like, hot girl. And I'm just like, it's like, no, okay, bye testosterone, we're done with you. I'm not interested in staying in the middle here or anything. But like, as I increased my estrogen and I lowered my testosterone, I spent that first year jogging a lot, and I got way faster than I used to be. And now I'm back to jogging again after a bit of a hiatus, and like physically it's much harder.
Yes.
It's estrogen HRT really lowers your physical capacity, primarily because it lowers your it like decreases your muscle mass over time, which is also why it becomes a lot easier to gain weight and a lot harder to lose it. And I mean, I have found that I am way happier with how I look when I gain weight. It's going to places that I want it.
Okay.
There's another HRT fun fact. There's this process that people go through called weight cycling. When you lose weight, it comes off of, quote unquote, masculine areas. It disproportionately comes off of masculine areas. And then when you gain it back, it disproportionately goes to feminine areas. So when you're on estrogen HRT, you can lose weight and gain it back, and lose weight and gain it back. And it generally adds to your curves.
Okay.
Interesting.
So it's kinda going through
there's a lot of stuff. There's so much stuff.
Oh yeah. And actually, with that thought, I want to, because I have this on my question. You might not, if you have nothing to answer with it, no worries. But there's a lot of misinformation about the effect of hormones. Is there a frustrating myth or something that you constantly hear about HRT that you want to dispel?
There are two things.
Okay.
One is that it's being irresponsibly handed out to minors, because that's not true. There has for decades now been a very reasonable and appropriate screening process to give HRT to trans youth. Like, there's hormone blockers which essentially pause puberty, and there is kind of more of an expectation to have consultations with a mental health professional to ensure that this is a young person experiencing gender dysphoria, as opposed to a young person who is experiencing the discomfort in their body that is very common, very real, but very common in puberty.
100%. Yeah.
Whereas people are talking about it like it's being passed out at hospitals like Halloween candy. It's kind of a ridiculous thing to say. There's been this panic that's been stirred up over something that has been handled very responsibly and intelligently by the medical community for years and years now. Now, the other thing is, and that's like a genuine concern about the health and like information literacy of our society and everything. This is a pet peeve. This just annoys me that this is kind of perpetuated constantly. There's just this constant saying that estrogen HRT will lower your sex drive. Not in my experience.
Yes.
And also not in my experience or in the experience of other people that I know who have been through it. The point is kind of that I feel like that understanding of like it's going to lower your sex drive may be based on a very narrow conception of what sex is and is supposed to be and who's doing what. with sex.
I'm
like
so
that.
glad that you're bringing it up
Okay.
because, putting my sex therapist hat back on.
Please.
Good.
A lot of clients that come in with reported low libido, which, by the way, what does that even like really mean, right? I mean, the definition of that can be pretty vast. But the number one like solution is to go and get your hormones checked. In my experience, and I think there's even like data to back this up, that's probably not the primary issue. More than likely, it's probably not, right? Like there could be, cases where if like a woman is going through menopause or perimenopause, like maybe there's something there, right?
Mhm.
But like majority of the time, you have to figure out what lower libido or lower sex drive like even means for the person, right? If that was the reason and then the solution was to like increase or like fix your hormones or whatever, I guess what I'm saying is I think a lot of people, and I'm talking about like cisgender people here for a second.
Okay,
like
yeah.
I'm getting out of like transitioning real quick, but like cisgender people. A lot of people just want the easy solution, right? Or like the easy answer. It's like
Yeah.
if your libido's lower, it's because of this. And then here you're gonna take this and it's gonna be fixed. Like that's what people want.
Of course.
I relate it to like men who have erectile dysfunction, they go and take Viagra and like that's the magical solution.
Mhm.
Typically that's not going to solve all your problems, right? There is a lot more nuance for sure. So I love that you're bringing it up because I'm like, it's almost like a pet peeve of mine too, where it's like, this is going to lower your libido. So you might want to be careful before you take it. It's like, I don't think that is just going to be the 100% truth.
Yeah. Thanks for saying that. Like, if anything, hormones are being passed out like Halloween candy, like I said, to cis people because, I don't know, pharmaceutical companies have decided that that's a cashable reason that you're not horny enough
Yeah.
for your own taste.
Yes. Yeah.
Whereas,
100%.
you should probably talk to your partners more and, if I'm being honest, get better sleep.
Yes.
But,
Fair.
that's also not really a sexual thing. You should get better sleep. We're not. It's like, I'm so tired.
Or if you're in a shitty relationship,
Yeah.
like,
Or stress. I
that's-
mean,
or
so
stress,
many.
or right, like whatever.
Yeah,
I mean,
or you're having the wrong kind of sex.
Oh, preach.
well,
which is a real
because
thing.
I see this a lot with women,
Mhm.
with cis women. They're in a straight relationship, marriage. Their libido's low. Something I'm always trying to figure out early on is the sex you're having with your partner. Is it sex worth having? Because if you're not having a good time, like what is there to desire, right? Like we don't have fun. There's no. If it's like just intercourse only and that's all we do and that's all I had to look forward to, then your libido might be low because it's kind of like what's being offered to you is not
Desirable.
It's like someone offering you a dinner that you're not gonna like. It's like, well, I don't know if I really want to do that. So that's like a big question, right?
Well, we had Brandy on. She put it like the perfect way that now that's how I think of it all the time. Like people will come to her and say,
oh, my sex drive, I can't really orgasm. my libido's really low.
Mhm.
and then Brandy will ask the question, well, are you masturbating? And they're like,
Yeah, all the time.
and they're like, okay, your libido's not really that low. You're just not having good sex with a partner.
Exactly.
Yeah.
Like
So,
there's
like-
there's a desire there. It's just not coming through maybe in the way you wanted or
Yeah.
whatever. So that's a
Yeah.
great question.
There is a thing that is better and better understood is that, okay, so a lot of transgender people specifically have genital dysphoria. They do not want the genitals that they have.
Mhm.
And as such, there was this very much repeated understanding that estrogen HRT would lead to erectile dysfunction and like loss of, penis function. That's only true if you don't, use it.
Okay.
It is kind of a use it or lose it thing.
Okay. Okay, if you don't mind. Again, this is
I'm a
you don't
top.
have to. I love it.
All right, question answered.
Got it. If you don't mind, how does sex look differently before and after? Like, is there a difference?
Okay, so before, it was kind of, how do I put this delicately? It was an empty, meaningless, flailing attempt to fill up a hole in my heart. And now it's just kind of awesome.
Okay.
Yeah.
Are the
Well, for one
things you're
thing,
doing-
I'm like,
Go ahead.
okay, so we got to know each other pretty well. Now it essentially feels like, one, I think that I had a very cis-normative, heteronormative understanding of sex before I started my transition. Like not as much as I got older and I grew up, and I've just embraced myself as a queer person before, accepting myself as a transgender woman. But I kind of had this very normative, simplistic understanding of sex, is that like sex looks like this. One person needs to penetrate the other person.
Yeah.
Like there can be toys, there can be all this other stuff, but like if you don't do XYZ, it's not sex.
Yes.
So for one, sex has become way more expansive to me. It has, like, sex can be other things. Sex can be just like weird psychological exploration of like various kinks and denial. Sex can be two people hitting each other consensually.
Consensually. Yeah.
That's kind of the key part there. Like if it's consensual and you've agreed that it's sex and you experience it as sex, then that's sex.
The consent piece is the only requirement I have.
Yes.
If someone is defining what sex is to them, that's the only piece that like has to be there.
Yeah.
Everything else, I mean, it's whatever you want it to be.
Yeah. The other side of it is whatever kind of sex I'm having now, like when it's with a woman, the hole in my heart is filled because I'm like, it's like I'm hearkening back to that moment where I found out what a lesbian was, and I'm like, I'm doing it. I'm having lesbian sex. This is a thing that I didn't really get to say. Like I'm bi. I still meaningfully consider myself bi. Like I find certain men attractive and stuff. It's just, but like I don't consider myself a lesbian, but I'm like, I would say I'm primarily sapphic. I kind of wish I considered myself a lesbian more because I love the term than anything else. But like I consider, like I'm dating another woman. She's a lesbian. I consider us to have a lesbian relationship, not like whatever other word you want to put on it. Like not to define your relationships and everything how you like, but like experiencing that. I've joked before that it's like I didn't transition so I could be a woman. I transitioned so I could be a lesbian. That's a joke, but it's a great perk. It's a pretty important bit of this to me. Yeah. And I've had people like say that like trans sapphic is an identity. It is kind of a thing. Why would your gender identity not profoundly influence your, sexual orientation?
Yeah. I mean, I'm all for if labels feel right, use them.
Yeah.
If like they feel comfortable, if they're good, use them.
Yeah.
If labels don't feel right to you, don't use them. I mean, that's just how it goes, in my opinion. Because there's going into the queer space, some people can be overwhelmed by labeling.
We do got a lot of words.
We have so many words. The amount of terminology that we could go. It's so much.
I get why there are that many terms.
Yeah.
Like sometimes finding a word or a phrase or whatever that resonates with you can feel really good. It can almost kind of be like a light bulb, like, wait, that's me, or I really resonate with that, or I identify with that, whatever. But I think the fluidity piece is really important, right? Because you can decide over time, like, do I still want to identify that way? Do I not want to use labels? Like whatever you want to do.
And it's again another discovery process. Or for the longest time, I hated the word lesbian. I had an extreme opposite effect of what you had. Like I could not stand that word. Same thing with butch. Could not stand the word butch. It didn't feel right. It felt wrong. Now I am a proud lesbian and I am a butch woman. Like I feel at home with those labels now. But there was a time where those labels just felt wrong and there was a lot of shame.
Yeah.
But yeah, okay. So going back, you brought something up that actually makes me want to transition into our next topic of this. You were talking about how a lot of the myths and misconceptions are the fact that we're handing out hormone therapy to kids like they're candy, right? Which is what you see in the media. That's exactly, you know, they're actually, Lindsay, if you don't mind, if you want to go through your own experience being a mental health provider, if you don't mind saying what actually just happened to you as far as being called a groomer in Texas.
I only work with adults, so I don't have the professional experience working with minors, but like I have colleagues that do that. And I think like going back to like the informed consent model, that's the best model, like in terms of therapy too, right? Like if a client came to me and was like, what do you know about this thing? Like, what would you recommend? I typically am not really like recommending like you should do this or that. I'm typically just giving clients what information I might know about something. And then I'll walk through with them, like, what might the impacts of that be on you, right? Like, what might you anticipate? What might you need to be like aware of or cautious of or whatever? But I do think like clients have agency, right? Like they have autonomy. They can make their choice. And I think like with minors, this is my personal opinion, again, not working with minors, but you know, minors have agency and autonomy too. Like I get the aspect of like they're minors, their parents probably had to like sign off on any kind of like medical intervention they're having. I think that is important. I think that should be there, right? But I do think kids know themselves better than we give them credit for. I think there's this like, well, they're kids, they don't know. And I'm like, but they do though. Like kids know things, right? Like I think kids know themselves, again, just better than we give them credit for, right? So if a kid like comes to their parent and wants to explore this, I think it's great that we have medical and mental health professionals that are helping them like guide them through that journey. And again, you're just giving them information. If you get older, if you change your mind, if you're not certain about this anymore, then you just got new information that you're going to get at that time, right?
100%.
So anyways, I'm just sharing that. But like, yeah, so I only work with adults, but there is an LPC or licensed professional counselor. There's another therapist like near Houston that wrote this House bill that she's trying to get passed. I think they're going to vote on it in like September, I think is what I read in the bill. But basically it would prosecute any mental health professional that helps a minor transition, even just socially transition. Let me say this first. Minors are not getting surgeries. Okay. That's the thing. Like, I think people are like, oh yeah, they're going and they're like chopping off body parts. And I'm like, no. That is not happening. You know, we're talking about like, Emmy, you mentioned earlier, like puberty blockers, right? Like HRT, like
hormonal intervention.
But this bill would prosecute mental health professionals that help a minor transition in that way, or even socially transition. So even if you're a professional and I hate to say giving permission, that sounds so icky, but I don't know like about it. But like if you have a minor client and you're just affirming, like if you want to dress differently, you could do that, right? Like that's fine. If you're even caught doing that, this bill would want to prosecute you up to 20 years. So this therapist wrote that bill, which is really gross.
That's evil.
It's evil. It's straight up evil. It's disgusting behavior. Also, you shouldn't be a fucking therapist if like that's how you're going to view the world. Like that is my really strong opinion.
Right.
Yeah.
Why are you in a helping field if you're actively going against helping people who really need help? Like I can't understand that, and I have no respect for her. Like if I saw this bitch in person, I would have a lot to say. I don't care if you're a fellow therapist. I have zero respect for you.
Okay.
And she's basically going on directories. And if you're listed as a trans affirming therapist, she's doxing us. So she's like sharing her information on Twitter, calling us groomers, calling us alienators. Like she did that to me. And I think she did it to the other therapist at my practice too. Like calling us names and kind of like trying to make it seem like people need to really watch out for us, and like shared our practice information, how to contact us, like my office address, all that kind of stuff, which is public information, but I didn't consent to her sharing it, especially in that context, right? So it was really like when I saw it, it kind of gave me chills. I was like, holy shit, like we're living at a time where just trying to do our job, we're receiving this kind of backlash. And then like, that's how I first found out about her, was like the doxing. And then I like looked more into her. And that's when I found like the House bill that she wrote. And I was like, we're in a really fucked up time.
Yeah.
So it's scary. Like the way I think about it is like, it scared me to be doxed, but also I'm a straight white woman. Like, I have a ton of privilege. Like, I'm going to be fine. Like, she doxed me. I'm really going to be fine. My business is going to be fine. Like, it's going to be fine.
Yeah.
But it still scared me.
Yeah.
So imagine like what trans people are going through, like times 100, right?
Yeah.
Like, is the way I think about it. So we're just in a really hateful time.
Mm-hmm.
And it's not just coming from, you know, your next door neighbor. It's coming from
Your
licensed
colleagues.
professionals.
Yeah.
Yeah, which is crazy to me. Because again, I've learned so much from you with this mental health space, and it's
Mhm.
only put me more towards acceptance and inclusivity.
Yeah.
So it's crazy to me, especially in Houston. By the way, Houston in Texas is one of the most queer-friendly places as far as like having spaces for us to go. There's a lesbian bar there, there's queer bar there, they have a whole scene. It's actually pretty big. So seeing not only that bill come, but we actually had a new bill introduced recently that's basically making it a felony to identify as trans, which is
Yeah.
mind-boggling to me. And it's punishable with, I think it's 2 years of jail and a $10,000 fine because they consider it fraud. And this was introduced like from Houston as well. And it's
But we have a president. First of all, fuck Trump. Okay. Anyone listening to this podcast knows I'm not going to sugarcoat that.
Yeah.
I fucking hate this administration. I hate that we're in this time. We could go another hour talking about that, right?
Yeah.
But like, we're in a time where he is perpetuating all this hate, and people who are hateful now feel very comfortable coming out with it.
Yeah.
And so like here in Texas, we're trying to pass this bill to make it a felony to identify as trans. But we have this president that has tons of felonies, that has committed fraud, that incited the insurrection, right? Like going back to January 6th, like we have all this crime happening. And I'm like, but we're trying to do this now.
Yeah. Yeah.
I'm jaw dropped. I mean, I want to turn it back to you. Like, I know you have your own thoughts about this.
Well, one, it's evil.
Yeah.
But I mean, it's part of the playbook.
Yeah.
Is that you create a problem that doesn't exist?
Yes.
Because I am in the community. People know me. The vast majority of people are just normal.
Yeah.
The vast majority, and they don't care. They don't care which bathroom I use. It's like, hi, Emmy, how you doing? I hang out with little old ladies at my church. People are chill. People are fine about stuff.
Yeah.
People don't mind me, but you create problems that don't exist.
Yeah.
Yep.
And then you solve them
Yeah.
to present yourself as a party or an administration that gets things done.
Some type of savior.
Yeah.
Well, no, it's like those people,
From a boogeyman that doesn't exist.
Right.
Yeah. It's like those people that, it's like a real thing. Someone will like set fire to a house or a building, and then they're also the same one who comes back around and like calls the fire department, and like they say, they like save the day, but it was like them who started it. It's like that savior complex. It's that.
Yeah.
Absolutely.
Yeah. So how are you emotionally navigating this then, Emmy? Like does it affect your everyday life being here in Texas in such a conservative state?
Yes and no. I don't know if y'all already know this, but last year the Texas Department of Public Safety stopped recognizing court orders to change gender markers on driver's licenses and on birth certificates, which is not something that they're actually allowed to do. You have to recognize court orders. The Attorney General actually just released an opinion, which I will remind everybody is non-binding, that changed birth certificates and driver's licenses should be reverted back. It's unclear how they're gonna do that. And on the one hand, I'm tired of people telling me that this is political theater. These people are coming after me and people I love. And it's not going to stop with us. It's not only happening to us, that these are the same people who are attacking immigrants and people of color and really just making life worse for everyone who's not a white billionaire. But sort of what it all really makes me think about, what brings me comfort is one, since all of this has started going down, I've been so much more mired in community and support and love with other queer people and other trans people and allies. And I've sought to be an ally to other communities that I'm not a part of,
Mhm.
ethnic minorities and undocumented documented immigrants. It's not just people who came here without documentation that they're going after. They're going after everyone
Yeah.
because they're evil.
Yeah. Yeah, bro.
But what really comforts me is this quote. It's actually from the show Justice League Unlimited, and I think about it constantly, and it just rings so true in my mind. A loser with power is still just a loser.
Yes.
That's great. That's
And the truth is that when you look at them and you remember that they're just losers with power, you understand that they can and will be defeated.
I hope so, girl.
Inevitably.
Did either of you ever watch Ted Lasso?
Yeah.
I think of that scene in Ted Lasso where I think it's like towards the end of the series and they're wanting to start this new football league that's like it basically is like exclusive to rich people.
Super League.
Super League, yeah. And
Which is a real problem.
And Rebecca,
Yep.
Is that her name? Okay, yeah, Rebecca. She owns one of the leagues, but a majority of the other owners of other leagues are all men. They're all rich men, and she goes in the room, like sits with them, and if you're at this table with all these rich men, it can be kind of intimidating. But then she just like imagines them all as like little kids because that's kind of how they behave, like immature kids. And then once she sees them that way, it's almost like she gets her power back because she's like, what am I being nervous for? Like, I'm at this table with these children.
Yeah, that's
right.
good. Yeah,
and like,
yeah.
I'm going to tell you how it really is. And it's like this really amazing scene. I kind of like think about that, right? Like, that's such a great quote. A loser with power is still a loser. You kind of have to look at them that way. And I think like all these executive orders coming out to me is, and not to like minimize the real threat here, because I think what's happening is really dangerous, right? Like, we still have to be really cautious, but to me, it's a sign that, Trump has to know that, like, he has a lot of power right now, but it's almost like he's grasping at anything he can get as fast as he can.
Yeah.
Before things get reversed, like reality sets in. Like, I think a lot of damage has been done. It's going to take us a long time to undo. But that's the vibe I get. Is like there's all these executive orders coming out every single day, and it reminds me of someone who knows I got to get all this fit in as quickly as possible because
I have 4 years at
I
this
don't
point.
really have that much like influence or whatever.
No.
Right.
I mean, I definitely agree with that.
Yeah.
It's definitely true. Like, it's an attempt to like dismantle democracy enough to hold on to like this disproportionate level of power that he pretends to have. He's trying to make an imaginary thing real.
Absolutely. 100%.
So just to kind of close us, because I think you are honestly the longest episode we've ever recorded so far. So a little bit of a Medal of Honor right there.
Thank you. Love to yap.
But I do want to ask, before I get into my closure question, if you could speak to young Emmy, like way back when you were like the most confused, what advice would you give Emmy? What piece of knowledge do you wish you knew?
I know the kind of thing that I want to say, but really the advice that I have two. What, you can be a girl. Just you can be a girl. You can be a girl.
Yeah.
And also stop bothering that girl. She's not into you. It's like just stop bothering her. Learn to hear no, and it's learn to accept a polite rejection. It's very good for you.
Okay, so yeah, amazing advice.
Thank you.
I love it. Okay, and then Lindsay, do you have anything before we close it out?
I don't think so, no.
Okay, all right. So I'm gonna ask you my closer question. You said you've listened to a couple episodes, so you probably already know what it is. But the 3 things that I've learned about the sex positive movement are: A, consent is key. It's number 1 rule, no matter what. 2, we're very inclusive. So all bodies, all lifestyles, everybody welcome. And then 3, we believe that sex education should be comprehensive, inclusive. So with that being said, I want to know both your formal and your sex education that you received at home. So what did your parents tell you? How'd they go through that conversation? And also, how did the school system provide you with sex ed?
Okay. At home, I was told as little as possible.
Okay, yeah. That's the most
Well,
experience.
nothing, but as little as they could get away with.
Really? Who had that conversation with you?
My dad, like, while we were driving, while he was so we wouldn't have to make eye contact, giving me minimal information. I think kind of just so that it would be sufficiently uncomfortable that I wouldn't ask follow-up questions. I think that's why I was a virgin until I was 20. I really feel like I thought like this was a hypothetical thing. I didn't really appreciate that. It's like you're probably going to do this at some point. We don't know everything about you, but you're going to get around to it. Oddly enough, this is way kind of outside the norm for Texas, but I got pretty comprehensive sex ed in high school.
Really?
Like, yeah, there was a day that we did it, and it was kind of like, it was abstinence promoting. It was, but I mean, even that kind of had a better angle to it than it usually did. It's like no form of protection or birth control is perfect. The only way to ensure that you never get pregnant, or you never get anybody pregnant, or you don't get STDs is to not have sex. But then they did explain how efficient all the different forms of birth control were, and how condoms worked and how to put them on. We're like, it's like pretty good job. Not a perfect score, but like pretty good.
And this high school was in DFW?
Yep.
Wow. What grade were you whenever they...
Freshman.
Even better. Oh my goodness. Ah, that is rare, actually. Yeah, because I did not.
Good job.
Get any.
Yeah.
Okay.
I know that's not the norm.
Yeah, I think me and Lindsay both didn't receive. You said did you? Yeah, you didn't. I didn't receive any either.
Right. Yeah.
Interesting.
Well, I mean, it was in that sweet spot because it was a private school, but it was not a religious private school.
Okay,
that's why.
Yeah,
that
makes sense.
That makes sense. Okay. Yeah. Light bulb. Is there anything that you want to tell maybe the trans youth or the people who are struggling? Is a message that you want to get out before we close? I
mean, just like two major things is that, like, find your people, find your community. Mm-hmm. They're out there. There are people who are going through the same things or similar things, or who just understand you, and they'll be there for you. Be there for each other. And the other thing is, there is kind of this unhealthy narrative that's kind of perpetuated towards trans people, that you have to transition by a certain age, or there's no point. You have to start hormones by a certain age, or there's no point. And that's very much like an internally generated thing. And like the thing that gets said a lot is like before 16 or 18 or 20, it's never too late. It's not too late. I started transitioning at 27. I've seen people who started transitioning in their 30s and their 40s. And like I've heard from people who started transitioning in their 50s and 60s. It's not too late. It's not too late.
I love that.
Mm-hmm.
Yeah, that's good. All right. Yeah. All right. So as a tradition, we always allow for like a minute or two. If you have anything that you would like to plug, I don't know if you're, you said you were acting before, or you had a podcast before. If you have anything, any service, anything that Instagram account that you would like to share, for people to reach out to you, contact you, or even watch your stuff.
I mean, like, everything's from most everything I have is like from before I transitioned, and that guy's dead. So a little too flippant, but moving target, complex notion. But I don't know. My socials are gonna go up on here. Give me a follow on there, and keep an eye out for stuff that I'm hoping to do in the next few months and years.
Yeah, we'll have Emmy's information, like where to find her on all the social media, so we'll have that like in this episode description. You can find her there.
Yeah.
All right, great.
Mhm.
Well, thanks everyone for tuning in. I mean, I think it's been an exciting episode for us. Lots of great information, and I'm sure this is something along the lines that we'll revisit this conversation in the future, right? And Emmy will keep in touch with you as well. I mean, might have you back on
Yeah, I
someday.
love
I mean,
this. I
there's
could
so
talk
much
to her
more.
all
Yeah,
day.
there's so much more to discuss here. But for anyone listening, we are open for listener support. And so you can support us for as little as $1 a month if you would like to do so. It just kind of helps keep us going. We'll just keep making content that you want, that you deserve. And please comment and let us know what you thought about this episode, what you learned, what you would like to keep learning about. And as well as if you have any topics that you specifically want us to cover, we would love to hear that. And, we're always open to listener requests. So, but again, thanks again for tuning in. We are Sex Positivity Unfiltered. And remember to stay curious and fuck politeness.